A shortage of anesthesiologists here in Tennessee is prompting a big decision for state lawmakers. Good evening and welcome to News 2 at 5. I'm Bob Mueller.
And I'm Haley Wilgus. Should anesthesiologist assistants be allowed to administer the medication? State Capitol reporter Tori Gessner breaks down both sides of this debate.
From surgeries to colonoscopies and childbirth, anesthesia is the invisible hand ensuring patients feel no pain. But in Tennessee, like many other states, there's a shortage of people who can administer it.
It's not just surgeries we're talking about. It's running the gamut of all of healthcare where we need anesthesia services, and we just don't have enough providers.
Feeling the pressure, Tennessee lawmakers say there could be a prescription. Let certified anesthesiologist assistants, or CAAs, practice in the state. They complete a 2-year anesthesiologist assistant master's program and have to pass a certification exam. They're required to practice directly under a medical doctor of anesthesia.
They are not practicing independent, but it does give, further reach. Instead of just, a medical doctor of anesthesia practicing, doing one case, a CAA can cover, and the doctor can cover more patients with that.
But Dr. Chris Hewlin, president of the Middle Tennessee School of Anesthesia, which trains nurse anesthetists, or CRNAs, says letting CAAs practice in the state would make healthcare more expensive.
They have no independent license. They can do no patient care without a physician anesthesiologist being present in a ratio of 1 to 4. So every time you have a patient encounter, you're paying 2 people.
Plus, he argues they wouldn't be able to work in the areas that need providers the most.
40 counties in Tennessee do not have a physician anesthesiologist living there. AAs cannot help any health care going on in those counties.
While Hewlin says the shortage of anesthesia providers is projected to improve in the next few years, supporters of the CAA bill say it'll only get worse.
Some of the concerns around it have been that this would some way hurt the CRNAs, but the simple fact is we don't have enough providers and nobody is pushing them out of the way.
The nurse anesthetists want to meet with lawmakers to present their own potential solutions to the shortage, including legislation to create rural training programs for CRNAs and allowing loan forgiveness to help retain providers. Bob.
Thank you, Tori. We want to hear from you. Would you be comfortable with an assistant anesthesiologist administering your anesthesia? Head to our website at WKRN.com to share your answers.